Hello, my friend. My name is Dr. Walim Suya. I'm a medical doctor, a co-founder of the Engaruka Healthy Community Organization, which is a non-profit, a non-governmental organization. We are building a health center which comprises of an outpatient department, a laboratory, maternity ward, and a general operating theater. Our aim is to really bridge the gap that exists in the healthcare services in rural Tanzania, to make sure that this community in Engaruka village and the surrounding area gets access to affordable, quality health services. They have to travel more than 35 miles, which is like 54 kilometers, to a nearby health center where they can have at least quality services. There is a big river that, floods during rain season, and therefore the roads becomes impassable. And therefore, if a woman has a problem, say an obstetric complication, they cannot deliver for some reasons and they have to go get cesarean section, they will have to travel all those kilometers, 54 kilometers, 80 kilometers to Arusha, or even 100 kilometers to Arusha to get good health services. Therefore, with that reason, we decided that we shall build a health center which will also have a maternity wing, operation theater, where, if a lady who is giving birth cannot, for some reasons, deliver normally, then we can help them here. So in front here where I'm standing, this is where the outpatient department is. And I can take you quickly through what it comprises of. Where I'm standing here is supposed to be the dispensing room, like the pharmacy, where patients will be getting their medications. To my right is the waiting area where people are waiting to go to reception. This area here is the reception. So patients who are coming from home, they will be received here, registered, ready to be seen by doctors. And this area here will be the cashier's office, where ECHO will not provide services for free, so there will be some cost sharing. And it is in this area where people will be paying their bills. And this area here will be a waiting area. So those patients who are waiting to go to see doctors, they will be here waiting. And also they will have their vitals being taken in this area. This area here is a small ward. So basically it could be for male or female, but for those who will need to be admitted, they will be admitted here. And to my right is also another ward, small ward, where those who are gonna need admission will be admitted. So this particular area here is meant to be the consultation area where patients will be seen by doctors. And after there, they're gonna be sent to the lab, or if they don't need labs, they can go where they are supposed to go. Let's say if they have a procedure, they can go to procedure room, and the procedure room is here. It's supposed to be our procedure room. It's almost done. People are doing now the last finishing work, but this will be the procedure room. The minor procedures will be done in this area. So the rest of the building will be some rooms for data room, and the other one will be just a storage. And this room here is supposed to be a conference. So where we are intending to have continuous medical education, and therefore people will be giving their talks here, the education talks in this room, and it will also be a room for clinical meetings. So a patient has been seen by the doctor, and if they're supposed to go get lab tests, they will be walking through this corridor to the laboratory building, and this is the laboratory building. Currently we cannot get in because there is work going on, but basically there is a reception where they will be received, and then there are rooms for different tests. So if they're gonna need a biochemistry test, if they're gonna need a parasitology test, if they're gonna need hematology test, there are rooms to do that inside. Unfortunately, we cannot see inside because there is no, we cannot pass through. So after they have been tested, they will go back to the waiting area which we saw in the OPD, where they will be called again to the doctor, and they will have their results, and they will be prescribed medications. So basically, these are the two buildings that we are intending to open in the near future: the Outpatient Department and the Medical Laboratory building. We are intending to serve the 17,000 population of Engaruka, but also thousands of other people surrounding this area, totaling to around 100,000 people that we are intending to serve in this medical facility. So after this building, we have this other building, which is intended to be our maternity ward. As I just said, women who need to deliver in this area will have to travel more than 35 miles away to at least get to a facility that can conduct a safe delivery. To mitigate that, that is why we decided to build this building. The maternity building does not just have the delivery rooms and the antenatal, postnatal rooms, but it also have its own operating theater, the obstetric theater, in one building, whereby if a woman will fail to deliver normally for some reasons, and if they need a cesarean section, they will be taken to a surgical, to the operating room, which is in the same building, instead of traveling 54 kilometers to 100 kilometers that they normally travel without this building. The building is at its, say, 70% of completion, and we still need to do the 30%. And the constraint is that we don't have money to finish that for now, but we are looking for people who can help us, people with goodwill, donors, philanthropists, who can help us finish this building and save lives of these women who are dying every day due to lack of, place where they can safely get their babies. So this building starts with a reception, and a reception area where, when women come from home, whether in labor or if they have an issue that needs to be admitted to maternity ward, they will be received here. Being, the nurses will do the vitals here and get the initial information from these women here. After there, they will be going either to the wards, and we have an antenatal ward where those who are waiting to deliver, they will be waiting. We shall see it later. But these two rooms here are intended to be post-delivery rooms. So there will be those who have delivered normally, like who did not need operation, cesarean section. They will be in this room, and those who has delivered by cesarean section will be in a separate room. This is a nursing office. The nurses will be here to those who will be looking at these patients either during the day or night. They will have their office here. And this small room here is intended to be an EQ, neonatal ICU, or where we can care for the neonates and prematures. So we are intending to equip this room with equipment necessary to care for premature babies. This room is for the antenatal, those who are waiting to get labor. They will be here. And with the geography of this area, some women will be coming from very far, and if we think they cannot go home and they have to wait a few days before they can deliver, they will be waiting in this area here. Other areas, these rooms are utility rooms. And these two rooms here are intended to be private rooms. Some women will not like to be in the general room, and they can have these two, either of the two rooms to stay after delivery. Yes, but they will have definitely to pay a little bit more than those who are in the general rooms. The two rooms we see here will be for deliveries. So there will be only 2 delivery rooms, which we think there will be enough given the population that we are serving. If there will be, if the need will increase, we shall see what to do later. But to start with, we have 2 delivery rooms. So that marks the end of the maternity ward, but to it is connected with an operation room. So if a lady who was to deliver in these rooms fails to deliver, they will just move some few meters to get to an operation room. So this room where we are now is an operation room, is an obstetric operation room, basically just for obstetric surgeries. Say a woman has failed to deliver, or if they have delivered and the placenta have not come out, or such kind of obstetric complications that need surgical intervention will be attended to here. The other rooms will be like, sterilization room. The other one will be where you take used equipment and clean them. This other room will be a post after surgery. Before they go to post-natal ward, they will come here to recover. So this is a recovery room, and once they have recovered, they will be taken to post-delivery room. The room that I showed, the room that will be specifically for those who delivered by cesarean section. This will be just a store for the maternity ward. This will be the office for the theater staff. So the doctor, after finishing doing the surgery, they will come here, write their notes about what they have done to the patient. The rooms to my right and left, they are changing rooms for staff who have to get into the maternity theater. And that marks the end of the maternity building. So the next building, and which is our last building, is the general operating theater. So this is mainly for those patients who either have gynecological problems. So they are women, but they have, surgical problems that are not obstetric. Say they have myomas, or they have other conditions that will need to be operated, but not to get babies. They will be going here. Or this is a man who have an obstructed or intestinal obstruction. They will be going into this building. So it is a general purpose operating building. The very first room here is anesthetist office. So those who are giving anesthesia will have their office here. The patient will be coming through this corridor, this walkway, get to here, and here will be the reception. So they will be seen here by the anesthetists, see if they are fit for surgery according to how they have seen them in the wards, or if they have not seen them before, at least to see quickly that they are fit for surgery, and to take history of those who came as emergents here. This general operating theater has 2 operating rooms. One is on the left, on my left, and the other one is on my right. And this is an area where those who are going to the theater, they will come here first before they get into the operating room. So to make sure everything is okay, the anesthetist and the doctor who gonna do the operation, they make sure that the patient is in a condition allowing them for a surgery. And if all pre-operative procedures has been carried out before they get into operation room. This room here is an office where doctors and nurses will be using it for writing notes for patients. This is just a storage room for the theater, and this is a post-surgical room or recovery room where those who have received their surgical procedure will be recovering before they go to the ward. And those are just washrooms. So after the patient has finished being operated, they will go to the recovery room, and those clothes and the utensils used for that particular procedure will be taken to this room where they will be washed before they are taken to the sterilization room. Likewise, those utensils used and clothes used in that room will be taken to this room from the other operating room, and then being cleaned, ready to be sterilized. So this, just like the other room, is an operating room. After the patient has been operated, they will be taken to recovery room, which is here. So it's just like the other recovery room. Those are washrooms. And after they have recovered from here, they will be taken to the ward now to continue with post-op management, post-operation management. This marks the end of the 4 buildings that ECHO is building to serve this community. So far, the laboratory building is done, is ready to be used, although it is not equipped yet, and we are looking for donors who are going to help us with the equipment so that we render the services that the community would desire. The outpatient department is almost done. It is at around 90% to 95% of its completion. We are doing the final work now to make the build finished. This has been made possible by donations from different philanthropists, and more money was given by our major donor, Dr. Lori Costello, who has given money for us to build the OPD, the laboratory, the maternity, and of course the general operating theater. There have been some other donors who came into play, and we are really grateful for what they have done. We have equipments to help us start the outpatient department, and we are really grateful to Project Cure, who donated equipment worth of almost 200,000 USD. We are intending to open in the near future, and we shall open with the outpatient department and the laboratory services. And as we continue rendering these services, we are looking forward to have more donors who are gonna help us with finishing the maternity ward, which is really important, and the general operating theater.